projects about the assessment of pharmacist's role in counseling and educate diabetic patients about proper use of insulin. Firstly, introduction. DM or diabetic mellitus is a common metabolic disorder with high prevalence in developing countries such as Iraq. It's characterized by absolute or relative insulin deficiency. Diabetes can cause many complications. Some of them are acute complications, while others are chronic. Acute such as hypoglycemia and other, and chronic such as cardiovascular disease or nephropathy. So insulin is the cornerstone for treatment in type 1 diabetes and eventually used in treatment type 2 diabetic mellitus. There are many causes that cause significant risk or error while during using of insulin. Some error are dose error, while other is error during preparation and administration of insulin. So the pharmacist can play an important role in educate and counseling diabetic patients about proper use of insulin. The aim of study is to evaluate the role of pharmacists in educate and counsel diabetic patients about use of insulin. Method. Study design method, an observational cross-sectional method used simulated patient was conducted during December 2017. A convenient sample of about 45 pharmacists located in northeast and west of Baghdad are chosen. Assessment of pharmacist role in pharmacist counseling role. The assessment was getting according to the table 1 assessment form according to the preparation, administration and storage of insulin. This is some technique about use of insulin, such as possible side effect of injection and how to resuspend insulin. Data analysis. Data input and analyzed using statistical package for social version 17 and also use of categorical data are expressed as frequency and percentage. Also the correct use of Spearman correction in the study to correct among the continuous variable. The test used in the study is Fisher-Exact test to test the significant differences between categorical variables. P-value is less than 0.05. It was considered significant. The result of study. More than 68% of pharmacists who provide some information to the patient, and this information may be correct or wrong, while others just repeat physician instruction or just give the insulin to patient without any information. This table shows the level of level of education. If the pharmacist educates the patient about at least 5 points of assessment form is considered to have good education. While in my study, all Iraqi pharmacists have poor education because it gives less than 50%. And according to the preparation of insulin, most of Iraqi pharmacists focus only on mostly on the injection and on the time of injection. And we know that insulin must be given 30 minutes before meal, while most of Iraqi pharmacists mention it's inappropriate or fail to correct specified time. This is according to the storage of insulin. Also, there's little percent who talk about the storage of insulin. And according to the injection technique of insulin, most of Iraqi pharmacists focus on choose of suitable site of injection. This table shows that there is positive correlation between Iraqi pharmacies, between patients and pharmacy, and number of staff with the information that's provided to the patient. Conclusion. Community pharmacy lack to sufficient knowledge to educate and counsel diabetic patients about proper use of insulin. Limitation. Although the study is limited by small sample size, but give a hint that most of community pharmacy in Baghdad have poor knowledge regarding insulin therapy. Recommendation. There is highly recommended to do further scale to confirm the finding of this study by using further study to assess the main cause of such poor knowledge among the community pharmacy to be able to solve this problem in the future. Thank you.
Bismillah. Assalamu alaikum. I'm مريم عاصف. Today we'll talk about knowledge, attitude, and the practice of pharmacists regarding dietary supplement, a community pharmacy-based survey in Baghdad, supervised by Dr. The introduction. Definition. What is the dietary supplement? Dietary supplement, as defined by the Federal of Food, Drug and Cosmetics, are the vitamins, minerals, herbs, and other botanical or amino acid dietary substance that used by men to supplement the diet either by increasing the total dietary intake or the concentrate metabolite, constituent, extract, or combination between all of these compounds. Prevalence and indication for use. Approximately half of the USA adults above 20 years old use at least one dietary supplement, and the out-of-pocket expenditure of this dietary supplement reached to 18 billion annually in the USA. Legislation and regulatory issue. Any standard regarding the content, the purity, the potency, the contamination, and therapeutic effect were the sole responsibility of manufacturing. So, in 2007, the FDA stated that the dietary supplement must manufacture in a quality manner, without contamination or impurities, and need to label accurately. This slide shows how do we read this, the supplement label according to the FDA standards. The danger of dietary supplement to public health. Some of dietary supplements seem to be very dangerous and have unsafe effect when they ingest orally, like ephedra, and some other may have the risk of contamination or adulteration of the harmful substance. Some of these supplements may delay the treatment with therapies of proven efficacy, and other may be danger to special population like children, pregnant women, and lactate mothers. Pharmacist rule on dietary supplement. شو معناتنا الرول تجاه dietary supplement? Fortunately, most of the consumer of dietary supplement know the role of pharmacist is effective in recommendation a dietary supplement. And also, the study showed that the consumer actually ask the pharmacist about their dietary, and they believe that the pharmacist should be able to give them most suitable, effective dietary. The aim of this study was conducted to determine the knowledge, the attitude, the practice of supplement in Iraqi pharmacists in Baghdad city regarding the dietary supplement. Subjects and method. Time and place of this study. This study was a cross-sectional study carried in private pharmacies in Baghdad, Iraq during the period from November 2017 to January 2018. Sample size. This study had involved of 80 pharmacists, and the inclusion criteria was graduated pharmacists that work in a private pharmacy. Data collection for each pharmacist involved in this study. There is two types of data collection. First one is the demographic data, including the sex, age, educational level, and years of practice in the private pharmacy. And the second is a questionnaire. The questionnaire was to evaluate the interaction between the pharmacist and the consumer of dietary supplements, and consists of 25 questions divided in 3 categories. For 3 categories. First 80 questions is about the attitude, 10 about the practice, and 7 questions about the knowledge. Result and discussion. The demographic characteristic of the participant. As we see, the most pharmacists that involved in this study were females and with a third scientist degree, and about mean age is 13 years old with standard deviation of 8.5, and the experience here were about 6.5 years with the standard deviation of 8 years. The attitude regarding the dietary supplement among the participants. The attitude questions like if the dietary supplement has a positive impact on public health, if it has a therapeutic efficacy, if the pharmacists have an knowledgeable about the supplement, if they also gave them also recommended a good dietary supplement to the patient or comment about these supplements. All these questions were answered by the pharmacist by agree or strongly agree, which gave the attitude a positive result. pharmacists practice about dietary supplements. Also, the question about the practice, if they have enough time for the patient and advise them about their dietary supplement, or have a scientific reference regarding these supplements, or they inform the patient or recommending a new supplement for them. All of these questions were predominantly answered by agree, and also gave a positive result about the practice. But that doesn't mean there is a lack of professional practice standards in monitoring and documenting and also inquire the patient about their dietary supplement, and this leak also occur in developed countries like Canada and the USA. Pharmacists' knowledge about dietary supplement, the increasing use of dietary supplement made the community pharmacists should have a very confident information about the safety, about the efficacy of these supplements. The study showed that the pharmacist actually has a good confidence about their knowledge in the dietary supplement, but they also show their willingness to have additional training in this field, especially in the interaction and the adverse effect, and also in the dosing and therapeutic use of these new supplements. As a conclusion, the overall knowledge, attitude, practice of a sample of Iraqi pharmacists in Baghdad city regarding the dietary supplement were positive. Limitation of this study, actually there is several limitations in this study. One of them is the small of the sample, the self-evaluation about the practice, and limited question about the knowledge. Also, there is not enough research conducted inside the country regarding this topic, and also unwillingness of some pharmacists to cooperate in this study. Thank you.
Talk about use of statin and risk prediction of cardiovascular events among Iraqi patients, as supervised by Assistant Lecturer Dr. Zainab Ahmed. Definition: we must first know what are atherosclerotic cardiovascular disease. Atherosclerotic cardiovascular disease is a disease in which plaque build up inside the arteries. It refers to the following condition: coronary artery disease such as angina, MI, cerebrovascular disease such as stroke or transient ischemic attack, and peripheral artery disease such as calcification. We must know risk factor for atherosclerotic cardiovascular disease. First, we have modifiable risk factor which can be changed, which includes diabetes, dyslipidemia, tobacco smoking, being overweight, being inactive, excessive alcohol, excessive stress, western pattern diet اللي هو يكون عالي بالsaturated fat, insulin resistance and hypertension. What about non-modifiable risk factor for atherosclerotic cardiovascular disease? These include advanced age, gender, family history, and genetic abnormalities. What about mechanism of action of statin? Statin are a class of hydroxymethyl glutarate coenzyme reductase inhibitor which inhibit rate limiting step of conversion of HMG-CoA reductase to mevalin weight, leading to final inhibition of cholesterol biosynthesis. What about the types of statin? We have different type, different doses, different intensity of statin. Low intensity statin decrease LDL by an average of less than 30%, moderate intensity by 30 to 50%, high intensity decrease LDL by more than 50%. Now for example, low intensity simvastatin 10 mg, moderate intensity simvastatin 20 mg, high intensity atorvastatin 40 mg. Adverse effect associated with the statin use: effects on liver. It causes elevation in liver enzyme to greater than 3 normal level, occur in less than 1% of normal individual, are those related effect of statin use. What's about its effect on muscle? Ranging from mild myalgia to the rare incidence of rhabdomyolysis. الرhabdomyolysis طبعا هو أكثر side effect يكون خطر، راح يكون fatal. بالنسبة للrash and allergic reaction, occur in small percent of patient require previous exposure to the same compound. الانسيدنس مثل ما قلنا مالتها كلش قليل. Require develop rapidly and produce immunological reaction. What about the clinical benefits of statin? نقدر نقسمها يعني its benefit عندنا for primary prevention and its benefit for secondary prevention. when to use statin for primary prevention, and the guideline and said we use it for primary prevention when we have all the following criteria, which are patient age between 40 to 75 years, they have one or more cardiovascular risk factor اللي حكينا عليها قبل شوية اللي هي dyslipidemia, diabetes, hypertension or smoking, who have 10-year risk factor of 7.5 to 10%. Statin used for secondary prevention اللي هو effort required to prevent further secondary cardiovascular disease in patients who have experienced cardiovascular disease before. الجايدلاين يعني يقول إنه هي كلش عندنا beneficial secondary prevention. What about risk prediction? And first, to prevent cardiovascular disease, we must predict the risk for individual patient. And this is the focus on of my study. I focus on prediction of risk for each patient. حتى according to it, the physician يقدر يقرر. Example of risk prediction include Framingham and risk scoring, American College of Cardiology, American Heart Association algorithm, and Q-risk. My study is on Q-risk to evaluate cardiovascular risk for 10 years for individual and patient. Both these risk estimator has the advantage of being derived can be assessed online, بس الادفانتج انه مال Q-risk انه has derived from large population database, فلهذا هو راح يكون accurate اكثر. What about objective of our study? To evaluate statin usage and 10-year and cardiovascular risk for cardiovascular disease among Iraqi patients. Study design. Our study is prospective, randomized and controlled trial to evaluate different statin usage among different disease states. Study conducted from the period during the period from November 2017 to March 2018. البيشنت كم بيشنت اختارنا 25 patient and we're using statin 16 and the patient not using statin. بعدين هسه راح نعرف ليش اختارنا patient ياخذون statin و patient لا. الداتا اللي حصلناها منها from الفرات and one general hospital and non-hospitalized patient. شنو الكرايتيريا اللي دخلناها مالتنا البحث؟ inclusive criteria patient اللي داخلوا كانوا statin irrespective to age and gender، يعني بغض النظر عن age و gender مالتهم. We're using statin at different doses or different steps of treatment for different diseases و have being replied to standard questionnaire. بالنسبة للإكسكلوسيف كرايتيريا pregnant or nursing mother المالجنسي not currently receiving statin for previous 3 months، يعني احنا أخذناهم واخدين يعني دراسة صار فترة طويلة حتى تكون accurate أكثر. Dementia and unable to give a precise information. Patient data sheet ولطيناها for every patient and كانت أن بها certain parameter مثل age, smoking, statin use, history, family history to evaluate screening for any cardiovascular events. هذا يعني الشغل مالتنا هنا focus on here Q-risk 2 estimator حتى نشوف يعني physician شلون دا يحسبون ال 10-year and risk factor according to certain parameter, age, sex, ethnicity and certain parameter and will not يعني be necessary to insert such as cholesterol, HDL ratio, systolic blood pressure. What about result? Result here I insert in the patient and the demographic data which include the age, residence and the smoking status. Age distribution. First and then we have in the patient and on statin use and patient non on statin use. Patient on statin use and راح نشوفهم بال هذا اللون الأزرق راح يكون أكثر distribution لهم بين 60 to 69، أما البيشنت not on statin use بين 50 to 59. بس بعدين راح نشرح ليش. البيشنت هيستوري أكثر بيشنت إن يستعملون ستاتين بالستدي مالتنا كانوا عندهم risk of stroke عالي سواء patient history أو family history. type of statin use أكثر statin استعملناه هو كان التورفاستاتين 20 ملغ تابلت، أكثر شيء يستعملوه العراقي patient. For primary and secondary يستعملوا for primary more than secondary prevention. البيشنت عندنا طبعا اللي ياخذون ستاتين شفنا ان هاي برسنتج ان من عندهم هايبرتنشن. ليش يعني هاي برسنتج من هايبرتنشن؟ لان هايبرتنشن هو عباره عن ريسك فاكتور فور اثيروسكليروتيك كارديوفاسكولار ديزيز. What about side effect? ان شفنا نسبه كبيره من البيشنت have developed in muscle tenderness, weakness as a result of statin. as a result أن سوينا management of side effects الفيزيشن سوالهم يا أما decrease in the dose or discontinuation of taking every day or change to fibrate. أكثر استراتيجي استعملوها الفيزيشن أن بالستدي مالتنا decrease in the dose. Here I insert cardio parameter for each patient to calculate an Q risk and a 2 which includes age, smoking, diabetes mellitus, and chronic kidney disease. And there is another table, but I do not insert it here because it is a little complicated. But I compare between the result of healthy person and the result of patient with cardiovascular disease. هذا المخطط ده نشوفه راح نشوف انه غالبا بغض النظر عن انه البيشنت يستعملون ستاتين او نوت اون ستاتين، شوف الميل انه بالجهه اليمنى اللي هو الكارديوفاسكولار ريسك مالتهم اكثر لان ديفلوب earlier than female اللي هم يكونون بهالجهه. بالنسبه للليميتيشن small sample size and due to short period of time. الكونديشن مالتنا سيلف أنا ريبورتد and not أنا باي فيزيشن، وعندنا قسم من الباراميتر not all was obtained اللي هم مثل الليبيد values والبلاد بريشر. and we having أنا use different أنا types of statin و different أنا disease for و different different duration of treatment، فما نقدر نحدد إنه هذا أحسن. For Q risk evaluation عندنا certain parameter حكينا عليها اللي هي total cholesterol to HDL. صحيح هي not required بس أكيد راح تأثر على النسبة، دائما هاي نعتبرها limitation of our study، لو حاصلين من كل patient كان الدراسة كانت accurate أكثر. use of statin for هسه نجي على conclusion. conclusion احنا الالدرلي patient أن فضلنا لهم statin أكثر من الأصغر بالعمر. ليش؟ لأن الأصغر بالعمر راح يكون عندهم الريسك مال cardiovascular event راح يكون أقل. الستاتين تشتغل على الهاير cardiovascular risk بالإضافة إلى أنه costly وتزيد الريسك مال adverse event. بالنسبة للبرايمري وسكندري prevention برايمري همتين مثل الارتريال بيشنت ما نفضلها الا اذا البيشنت عنده هاير كارديوفاسكولار ريسك، اما بالنسبه للسكندري بريفنشن راح نفضلها، مع انه الدراسه مالتنا كانوا نسبه عدد كبير من البيشنت اخذوا البرايمري بريفنشن، فنقدر نسوي لهم ريكومنديشن الا اذا هاير كارديوفاسكولار ريسك يلا نقدر نديهم ستاتين. قسم من الجايد لاين عندنا said that the statin benefit and for high cardiovascular risk regardless of their cholesterol value. When using a 10-year risk and factor, we calculate the benefit and the side effect for each patient, and we can determine a 10-year risk score. بالنسبة للpatient at low 10-year risk factor, and future studies are required to support whether the benefit outweighs the adverse effect or not. Thank you.